Without nurses, our healthcare system falls apart. But burnout among nurses is approaching crisis levels. And in study after study, it's young nurses that are feeling the pressure the most and leaving the profession. What can be done about it? My expert guests have pioneered a visionary idea. Hello, Vermont. There was a moment, a very brief moment during COVID, when it seemed like we all saw nurses as the heroes that they are. So, how do you square that with recently announced plans to, for the purposes of student loans, exclude nursing from the list of professional degrees? We're already in a severe nursing shortage. Won't this demotion in status and financial aid eligibility turn off aspiring young nurses? It's worrisome, and that's on top of the escalating rates of burnout, stress, and mental health challenges reported in nursing. My guests today are both nurses themselves and clinical associate professors in the College of Nursing and Health Sciences at UVM. Lili Martin and Rebecca Nagle are here today to talk about a course they've developed to promote self-care and start building resiliency among student nurses before they ever join this challenging and incredibly vital workforce. Lili and Rebecca, welcome.
Thanks for having us.
I am so glad to have both of you here today. Yeah. I am going to go ahead and note that I think that this color combination is pretty awesome.
Very unplanned.
Yes. Well, I personally, I always kind of love the scrubs game of nurses, you know, when you're, and this kind of has a bit of a nursing scrub feel, so love it.
Like minds.
Like minds. Well, that's great because we have like minds in order to start, you know, working on this course. And so before, you know, we talk about the course, let's talk a little bit about nursing. What do people not understand, or what does it seem like we don't understand about the profession?
Yeah, so I can take this one. Nursing is inherently a meaningful profession. I think we all go into nursing because we really want to care for patients. What I think it's a little bit more difficult for the public to understand is what that looks like in practice. Nurses are being asked to continually, monitor the safety of patients and are making clinical decision making throughout their shifts. That puts a really hard cognitive load on nurses.
It's a lot of strain.
And at the same time, we're walking alongside patients when they're undergoing difficult medical treatments or are suffering in some way.
So there's a lot of emotional care as well.
And that's a huge emotional load. So couple that with a nursing shortage or maybe short staffing, and you can see where burnout and compassion fatigue really happen. The good news is, though, the evidence is very clear that if we support nurses in caring for patients on both a systems level and an individual level, we really see improved patient outcomes, improved patient safety. Nurses are happier at their jobs and more engaged in the organization they're working for, so the quality of care really improves. So there is, ways that we can really...
And there's a lot of reasons for us all to be invested in it, because we are talking about, ultimately, if you're a patient, you want to be certain that the nurses who are surrounding you are able to continue to provide that incredibly intense level of care.
And the care that they want to provide.
And the care that they want to provide. I have a sister, one of my beloved sisters is a NICU nurse, so nursing is something that is very, very close to my heart, and I feel very passionately about all of this. So how bad is the nursing shortage right now? I mean, like, what's been going on since COVID, say?
This is a complex one. So what's important to recognize is the nursing shortage isn't just happening in Vermont. This is a nationwide issue, and a lot of the driver, or big driver, is that the demand is really outpacing the supply of nurses that we have. And part of that is due to an aging population. So people are living longer, that's a good thing, but they also tend to have more complex medical needs. So that's a huge issue that we're seeing as well. Additionally, COVID didn't cause these issues. COVID exacerbated these issues. So we saw higher rates of burnout related to the pandemic. Patients were more acute, nurses were watching people die more frequently, and that actually led to more early retirement. So nurses retired earlier than they normally would have, or that's what the data is showing, and then nurses that left the profession altogether. So, and that's a huge problem and a huge contributor to the nursing shortage.
And I feel like during COVID, we did. I mean, like I mentioned it in my intro, like we had that awareness of what was happening
Yeah.
in nursing for that moment in time, because our
Exactly.
focus was so, you know, we were so paying so much attention to what was happening during that particular crisis. But it hasn't abated for nurses.
You know, and then furthermore, you know, nurses, so we think about our new nurses that are entering the profession. You know, our new nurses who've been in practice for the last 5 years, you know, they're still novice. And when they entered the profession, they entered in a time when the system was in crisis. So training was disrupted, mentorship opportunities, you know, there were fewer of them. And so that really contributed to their development of the burnout, and that's still present today, and they haven't fully recovered from that.
And you've looked at a lot of data about the mental health care or the mental health situation of nurses. What's going on?
Yeah, so a study that was conducted by the American Nurses Association, you know, they did a COVID impact study to see what was going on, and they found that younger nurses, particularly those that are under the age of 35, have higher or experience more anxiety, more depression, ultimately more burnout. And part of that is because of what we just explained. You know, they had lacked mentorship and training was disrupted. And then nurses that are over age 55 had less of that. Doesn't mean they don't experience, you know, the anxiety, depression, and burnout, but the theory was that they had more time to develop their professional identity before the healthcare system was in crisis. And so that's something to think about. And then something we don't talk about enough is, you know, nursing is a calling. That's how we frame it. And I think you mentioned that already. But that can be problematic. Nursing research has shown that when we frame nursing as, oh, it's a calling, it's this altruistic profession, it can lead nurses to feel guilty and shameful when they do develop the burnout.
Right.
And that's an issue, because then they might be less apt to speak up when there is a systems issue or a safety issue, like, you know, low staffing, or it forces them to put all the patient's needs before their own, you know, going to the bathroom, taking a break, saying no to working overtime. And so those things can be really problematic. I mean, I came into nursing because it was a calling. So I love that phrase, but we need to still support nurses in responding to these systems issues.
And this is how we get now into the UVM course, because I can see where then, you know, you have a situation where we want to help these younger students, these emerging nurses, these nurses in training, to start developing these skills early on. So do you want to tell us a little bit about the course?
Yeah, so when we were looking at the mental health concerns rising in our nursing students, but also in adolescents across the country, we felt like you know, we want to address the complex systems issues, but how can we support nursing students better while they're in school, so that when they transition to practice, they have some of those skills. So we developed a framework in this course that really looks at empowering students around leadership skills, stress management strategies, and you know, really a robust reflective practice that really helps support nurses as they transition into practice. And we have a lot of fun doing it. We have, you know, it's a great community connection building for students. Our experiential days are days where we experience different.
Tell us about some of the things. Like, what are some of the skills you're building? Because when you mentioned even things like, you know, having the, you know, the confidence, I don't know if confidence is even the right word, but to say, I need a moment, I need to go to the bathroom. I hadn't thought about that is actually something that you might need some preparatory training to be able to have that confidence in your professional setting to say, I'm taking this moment for myself, for example. So tell us a little bit about the skill building.
Well, we look at mindfulness, you know, techniques, you know, breathing. We have a lot of fun. We dance. We use music. We talk a lot about the power of nature, both for yourself, but also
some restorative
for the patients.
practices.
Restorative practice. We cook. We cook in the kitchen lab at UVM together, which really ties in their own self-care, but also how we can transfer this to patient care, how it's good for the planet. So, you know, we really kind of can expand what the strategies really will
ultimately with the goal of helping them build more resiliency. To be able to manage through those types of stressors when they're in a work setting. And the feedback we get is that students are utilizing. Well, how have
some
students
of these,
responded?
You know, they've responded really well to the course. and they recommend the course to other students.
It's a elective.
It's an elective
And,
course.
and
yep.
nursing, that's hard because I know that nursing program is very packed. And so I think that you weren't even sure when you started the course whether or not students would take it because they wouldn't have room, but yet you found that it's full all the time,
We
right?
were so concerned, we're putting all this work in and we're so passionate about this course. What happens if 2 people sign up, But in the first semester, I think we had 14 students in the class, and with the exception of one semester, over the last few years, we offer it every semester. Enrollment has risen, and now we have 30 students in the course, and it filled up in 1 day, 1 or 2 days of course registration. And it's capped at 30. That's our choice, but we think if we even increase the numbers that we would fill it as well.
Well, because it's providing a really valuable service. And so are other nursing programs around the country doing this? Like, how unique is this kind of course?
We might be a little biased to this, but we feel we're really ahead of the curve here at UVM with this course.
That's okay, you're allowed to trumpet
We're allowed
UVM
to say
right
that. We developed it at a time, again, kind of in the midst of the pandemic. It was early 2022 when we were building the course, so we were really still in the thick of things. And at that time, when we proposed it, to various peers, people, not necessarily UVM peers, but externally, it was like, oh, how are you going to do that? People were kind of surprised, like, do nurses even need that?
Wow.
No one, we met a lot of support, but also some pushback from various people in the profession, like, oh, is that fluff? Like, is that really that important?
Well, I can imagine that because it's the emphasis on clinical and on clinical skills
and passing the boards
and passing the
preparing
boards.
them,
I
which
mean,
is so
it's
important.
Obviously very important.
Not to diminish, but around the country, from what we've seen, there might be some programs that offer similar type of work, but it's not consistently integrated into nursing programs.
So this is really novel.
Yeah.
As nurses, I mean, we're going to kind of wrap things up, but as nurses, how do you feel about the challenges facing the profession right now?
I think it's really important that we look at, and I know nursing leadership is really looking at here at UVM and across the nation, how to better support nurses in caring for patients so that nurses will sustain in the profession. We're seeing now that a lot of new nurses are leaving the profession within 2 to 3 years or considering that. So how can we really keep them in the profession?
And here you are doing your bit.
Yeah.
I think this is really wonderful, and I'm so happy to have had both of you on today to be able to talk with us about the course, but also just to talk a little bit about nursing. It's one of those things, every time that you encounter a nurse, wherever you are, be certain that you kind of a real thank you for everything that they do for us. And thank you, too, for joining me today.
Thank you so much.
Thank you very much.
As always, Vermont, thank you for learning and exploring with me today, and thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.